Hi, David.
Hi, Andy.
Thanks very much for joining me for this interview, David. Can I ask you to start by introducing yourself, please?
Yeah, so my name is David Finch. I've worked in the care industry for just come up to 26 years now. I am the current chair of the Suffolk Association of Independent Care Providers. Took over in July of last year, and I'm also the managing director of a care company in Suffolk.
All right, okay. Can you tell me just a little bit about the association itself?
So the association has been going for a number of years now. It was originally set up to give the sector an independent voice with the council. It's evolved over those years. I've been involved with the association for around the last 5 years. 1 year, the first year was just about going along to meetings. Then I became a director, and then last year I put myself forward to be chair, as the current chair was stepping down.
Okay, thank you, David. I'll go into the first question, and it's one I ask everyone, and that's how are you looking after yourself during this pandemic, and also how are you supporting your team?
So looking after myself, I say my job is Monday to Friday, but you never really switch off. So I think what I've tried to do is make sure I do switch off at weekends. I tend not to answer emails after 7 o'clock in the evening. Just some few simple rules really to try and just switch off and forget about. I know it's hard to forget about COVID, but just to try and focus on other things like family.
And the team?
It's difficult because I have two teams really. I have my team with the association, and I have my team with the care company that I manage. With the association, it's been about making sure we don't overwork people because we are all voluntary, and most of the directors and that are part of the association also run care homes or own their own business. So they've had all of that stuff to do, and the association stuff. So I've been mindful not to sort of put too much onto them. But we have a wonderful administrator, Moira Weller, who I would have been completely lost with during these last 4 months.
Thank you. Yeah, I need to learn from you about looking after myself more, definitely. I like that. No emails after 7 p.m. My team would appreciate that as well.
But yeah, sorry, and just sort of coming back to my other team,
yeah,
the care company I manage. I mean, that's just I've been trying to. I make sure I spend time to talk to them. So every day I take time out and go and speak to them, make sure they're okay, just make sure everything is okay, that they're not working too many hours. If there's any challenges that have come up, that we face them as a team rather than individually. Just if I see someone who might look a bit tired, just making sure that their line manager has a word with them, just to ensure that they're okay.
Good. Thank you, David. Second question is this: what has been a standout negative from this outbreak, and what key positive can you take away?
For me, a standout negative has been the ever-changing guidance around COVID. It's been so difficult to make sure that every provider has got the most up-to-date guidance because it has changed on such a regular basis. And I think the other problem is the staff in the sector have got very used to the 5 o'clock briefing on the telly. So on would come a minister and say, right, all care homes are going to be tested, and staff would expect that to happen from the Monday if they'd said it on the Friday. And of course, in reality, because a lot of that testing was local testing, it was possibly 2 or 3 weeks before that process started. And I think there's been perhaps just they needed to be a bit more in depth with the information that was coming out. And 1 minute we're using one mask, then we switch to another mask, then it's a mask for each visit, then it's a mask for each period of time. So to me, that has been quite a bit of a negative. And if I look at the emails that have come through from our members, that has been probably one of the biggest around what guidance do I follow. As for positive, I think what I have taken positives from is the health adult social care and providers working so much more closely together. Prior to COVID, it was a little bit hit and miss, where now we've almost been forced, I know that sounds a strong word, to actually work together. And I think that has been a big positive, and I'm hoping it continues once. I know we're now entering perhaps a recovery phase of COVID, but that continues moving forward, because having health and adult social care work together has got things done a lot quicker and a lot better.
Absolutely. It's interesting you're talking about PPE. That's the impression that people have anyway. Is training also a negative, or was that something that was actually handled pretty well?
Training around
use of PPE, for example.
Yeah, I mean, there was lots of things thrown at providers about how to do this, how to do that. And I think there was PPE champions that eventually came on stream, but again, we could argue that was perhaps a bit too late, and that we needed those PPE champions maybe 3 or 4 weeks earlier. But you know, hindsight is a wonderful thing. But like I say, I think people have had to adapt to different styles of training, because pre-COVID, someone could come into the home and do the training, and you know, Teams and Zoom are all very great things, but it's not the same as face-to-face.
Of course. And you're absolutely right about everyone being forced to work collaboratively together, because everyone realised very quickly that they couldn't do things individually.
No, and I think that came across certainly in the first few meetings that we had. You could see people getting used to working together, but once we got past that, you could see documents that we were working on together. You had health saying, well, we need to put that in, and then as providers, we'd go, hold on a minute. You know, a prime example was we had a staff risk assessment that was sent by health. Now, of course, you can imagine their risk assessments are very in-depth. And we were saying, well, we can take bits from that risk assessment, but we could not do the whole risk assessment because we just wouldn't have time, because I think it was like 9 pages. So I think we've all got used to each other and how we do things, but it's been great to be able to input into documents that have gone out across the county and bits like that.
Good. Thank you, David. Third question is this. So as chair of the association for the first time, what have been your challenges during this pandemic?
Well, when I first took on the chair, I obviously spoke to the outgoing chair, and you know, you normally have around 10 emails a week coming in from providers with questions. At the height of COVID, we were averaging between 30 and 40 per day.
Oh.
So a challenge to me was to make sure there was enough time to answer all of these emails, because you know, being chair is my voluntary role. So it's making sure there was enough time in the day to answer them, and also trying to fix the problem. So certainly we talked about PPE. PPE was a massive problem when it wasn't available, and it was trying to liaise with Suffolk County Council. Can you get some PPE to this provider? They're going to run out. So it was bits like that, and just down to simple things like, I don't know how I'm going to feed my residents, because the shops had run out of pasta and tinned food, and yeah, so that was challenging, and I think sometimes it was difficult for me because there was stuff I couldn't solve, and I think you sometimes get very frustrated when you can't solve a problem. But yeah, I think looking at say the food situation, we were able to say, look, there's lots of wholesalers that I can put you in contact with. So instead of having to buy 10 bags of pasta from the supermarket, you can go and buy 1 big bag. And because a lot of restaurants had closed, these wholesalers had lots of food. So, and down to things like, you know, I had one gentleman ring me up saying, I'm on the front page of the newspaper of my care home, and I don't know what I'm going to do. So we were sort of liaising between the council with the newspaper, just trying to reassure him that, you know, this isn't the end of his business. So yeah, it's been extremely challenging, but also quite interesting.
I think I had one home whose chef shield and they were desperately looking for a replacement chef during the early weeks of the lockdown.
Yeah, and yeah, I think that there were so many different problem-solving things sent to us. Like I say, whether the right word is interesting, but it's certainly been challenging, and I don't know whether to use the word enjoyed it, but I suppose I've enjoyed helping other providers.
Thank you, David. As a result of everything that's happened, it's always important to think back and look ahead. So my last question is about what the learning and the challenges you think will come from this outbreak.
I'm hoping that they will see, central government will see social care as important as the NHS. I think from the beginning, I think it was clear that we weren't, and a lot of people have seen that, and a lot of carers said, well, why have we not had that? Why have they got to wear all this PPE, but yet we still don't have any? So I'm hoping that someone will say, if this happens again, we must treat social care and the NHS the same. So the guidance is that, so we all got masks from the beginning, we've all got the PPE from the beginning. And I think, to me, I hope we learn from that. We've learned a lot already in the fact that, we have a lot of guidance already in place and policies and bits like that. But yeah, I just hope we're seen as an equal.
Absolutely, completely agree. You're interdependent on each other, and if you're not seen as equal, that impacts on the whole system, not just social care.
It does, and I think, I was a bit annoyed the other day when there was an announcement that the NHS had been given $3 billion to prepare for the winter. And don't get me wrong, the NHS do an absolutely marvellous job. But I think I tweeted, well, did I miss the announcement for social care getting some money to prepare for the winter? And yeah, we also need to prepare for the winter. So hopefully at some point someone will say, well, here's some money for you to start preparing as well.
Can I just ask you one other thing? It's about your relationship, and that's care homes' relationship with the wider system, with hospitals, with primary care, GP services. Is there any learning from that?
I think there is. I mean, the GPs across the county, most of them have been excellent during this process. There have been some difficult times where GPs have refused to go out, but that's been very few and far between. And there's been homes that have really struggled to get medical interventions when they were needed. Generally, with the hospitals, most of the time it's been great. But as you normally do, sometimes you get discharges that maybe you don't have the right information, or you struggle to find out whether I had a COVID test prior to leaving the hospital. But again, I think that's stuff that hopefully we can learn and get better at.
Okay. And if you don't mind, just another, because of other interviews, because of bereavements and because of the number of deaths, sadly, the impact on staff, what's the future like for staff and their mental health? And also, what's the future like in terms of recruitment and retention of staff as well in the care sector?
So staff's mental health at the moment is, you can start to see it starting to have an impact. We've all been running on adrenaline for these last 4 months, and now as things are slowing down, you can start to see that people are getting tired. And you speak to, I've spoken to some staff and they've been there and they've watched person after person pass away, and they've had to, in a sense, take that role of the family member because they've not been able to come into the home. So I think it will have an impact, and we need to make sure that there is enough resources there to support staff who predominantly, I think, we will see an increase in staff with mental health issues. As for recruitment, it's a difficult one. I think some people have been drawn to coming into the care sector because of COVID. They want to make a difference. Others have left because they don't want to put themselves in that position. And I think, when you see the newspaper headline, carers are top of the list most likely to die from COVID, that's not the best recruitment slogan that you can have. Um, but our carers have done an absolutely marvellous job. I've seen some really marvellous stories where people have moved into care homes, or they've camped outside care homes to make sure that you haven't got people coming in and out. So care. I think care is a profession that we want people to come into. But we've got to make it professional.
It's a good note to end on, David. Thank you.